Appropriate bathing frequency for older adults. Essential considerations. Did you know that many seniors don't need to shower daily? And in fact, showering too often can be more harmful than helpful. However, why is this the case? Does showering less frequently affect hygiene and health? And what is the truly ideal showering frequency? The facts may surprise you and could completely change how you care for your elderly loved ones. Discover the answers in this video. 1. Appropriate bathing frequency for seniors. Why don't elderly individuals need to shower daily? As we age, our skin becomes thinner, drier, and more vulnerable due to a loss of natural oils. Frequent showering daily can strip away essential moisture, leading to dryness, itching, and cracking. Cracked skin can allow bacteria to enter, potentially causing infection. In youth, sebaceous and sweat glands are highly active, necessitating frequent showering to remove excess oil and dirt. However, in older adults, these glands become less active, resulting in reduced sweating and oil production. Therefore, daily showering isn't necessary to maintain cleanliness. Many older adults lead less active lives, with less exposure to dirt or pollutants. Consequently, they don't sweat as much as younger individuals and don't require frequent showering. Optimal bathing frequency, 2 to 3 times per week. Experts recommend that 2 to 3 times per week is the ideal bathing frequency for most seniors. This maintains hygiene while protecting the skin from dryness. However, individual needs and health conditions may necessitate adjustments when more frequent bathing is advisable. Some individuals may benefit from bathing more often, including those who are very active, frequently go outdoors, exercise regularly, or garden. Those experiencing excessive sweating due to medication or medical conditions. And those with skin conditions like seborrheic dermatitis requiring more frequent cleansing when less frequent bathing is advisable. Conversely, some seniors may benefit from bathing less frequently. This includes individuals with cognitive impairment, dementia, Alzheimer's, who may fear water or be uncooperative during bathing. Those with mobility challenges or a high risk of falls in the bathroom. And those with severe dermatological conditions, e.g. psoriasis, eczema, who should limit water exposure. Alternative solutions for individuals who cannot shower daily. For seniors or individuals who are unable to shower frequently, maintaining hygiene and comfort is achievable through several methods. Dry bathing, partial bath, damp towel cleansing, involves using a damp cloth to gently cleanse areas prone to bacterial buildup, such as the face, underarms, groin, and feet. Pre-moistened wipes designed for sensitive skin or waterless cleansing cloths offer a convenient alternative, particularly suitable for those with mobility challenges or a dislike of showering. The use of talcum powder or deodorant sprays can help maintain dryness and freshness in the underarms and groin area between showers. Changing into clean clothes daily, including underwear, is crucial for maintaining hygiene even without showering. Finally, diligent hand washing and regular foot and nail care are essential to prevent bacterial accumulation and infection. 2. Why bathing can sometimes be challenging. Physical and health concerns. Limited mobility. As we age, muscle weakness and reduced joint flexibility can make even standing for short periods in the shower tiring. Conditions such as arthritis, osteoporosis, and spinal degeneration can cause pain when moving or lifting legs to enter a bathtub. Individuals who have experienced a stroke or have Parkinson's disease may also experience balance difficulties while bathing. Solution: using a shower chair, grab bars, and a handheld shower head can significantly reduce strain. High risk of falls. Bathrooms are areas with a high risk of falls due to slippery surfaces, water accumulation, and confined spaces. Falls can result in fractures and head injuries, particularly serious for older adults. According to the National Institute on Aging, bathroom falls are a leading cause of injury among seniors. Solution: employing non-slip mats, installing secure grab bars, and preventing water accumulation on the floor can mitigate this risk. Fatigue and exhaustion. Bathing may require more energy than previously experienced, especially for individuals with cardiovascular disease or general debilitation. Prolonged exposure to hot water can cause a sudden drop in blood pressure, leading to dizziness or fainting. Solution: divide the bathing process into smaller segments. Wash the face first, then the arms and legs, followed by the rest of the body. Reduce bathing time and use comfortably warm water. Psychological and emotional aspects. Loss of independence. After years of self-sufficiency, requiring assistance from grandchildren or caregivers with bathing can cause seniors to feel shame, discomfort, and a loss of self-esteem. Some may refuse to bathe to avoid exposing their bodies. Solution: empower seniors with as much autonomy as possible, offering assistance only when truly necessary. When help is needed, using towels or bathrobes can minimize discomfort. Fear of water and cold. Some older adults, particularly those with cognitive impairments like Alzheimer's disease or dementia, may experience aquaphobia or fail to understand the necessity of bathing. They may react with resistance, shouting, or refusal. Cold water or sudden temperature changes can also be distressing. Solution: maintain a warm bathroom temperature beforehand. Gently explain the importance of bathing, potentially framing it as a pleasant routine, e.g., playing soft music using fragrant soap. Bathing as a mental burden. For some seniors, bathing can become an unpleasant chore, especially if they have experienced previous injuries or falls in the bathroom. Individuals with depression or cognitive decline may lose interest in personal hygiene, leading to bathing refusal. Solution: transform bathing into a more relaxing experience by playing music, using aromatherapy, or allowing the senior to choose their preferred bathing time. Encourage rather than force, fostering a sense of comfort and well-being. The bathroom environment is unsuitable. Unsafe bathroom design. A cramped, poorly lit bathroom with a slippery floor and a high bathtub can cause anxiety in elderly individuals. The lack of grab bars or a seat increases the risk of falls. Solution: improve bathroom design by installing grab bars, using a shower chair, and placing non-slip mats. Use brighter lighting to improve visibility. Inappropriate water temperature. Elderly individuals have thinner, more sensitive skin and are more susceptible to temperature extremes. Water that is too hot can cause burns or hypotension, while water that is too cold can cause discomfort or fear. Solution: adjust the water temperature to a comfortable 37 to 40 degrees Celsius, avoiding extremes of hot or cold. Use a handheld shower head for easier temperature control during showering. 3. Safe and comfortable bathing solutions. Enhance bathroom safety. Install safety aids. Grab bars provide support for entering, exiting, and showering. A shower chair or bench allows for seated showering, reducing the risk of falls. Non-slip mats placed inside the tub, near the sink, and by the door prevent slips and falls. A handheld shower head offers greater water control, especially for seated showering or targeted cleaning. Benefits: reduces fall risk, improves balance, and enhances safety. Adjust temperature and lighting. Warm water, 37 to 40 degrees Celsius, is ideal for maintaining body temperature without causing burns or hypotension. In-room heating or a heated towel rack prevents sudden chills when undressing or after showering. Bright yet soft lighting prevents glare while ensuring clear visibility, minimizing fall risks. Benefits: prevents thermal shock and promotes a comfortable showering experience. Adjusting bathing habits for seniors. Choosing the right bathing time. Morning showers invigorate seniors, stimulating blood circulation and reducing morning stiffness. Evening showers are suitable for those with sleep problems, promoting relaxation and stress reduction. Avoid bathing too early or late, especially when the ambient temperature is low. Benefits: bathing at the optimal time enhances comfort and minimizes the risk of heat shock. Shortening shower time. Limit showers to 5 to 10 minutes to prevent heat loss and potential drops in blood pressure. Consider dividing the bathing process. For example, wash hair one day and use warm towels to cleanse the body the next. If a senior feels fatigued during bathing, they should rest by sitting on a shower chair. Benefits: this reduces the risk of fatigue, hypotension, and falls due to prolonged standing. Alternative cleansing methods. If frequent bathing is difficult due to illness, use warm, damp cloths to cleanse the body, paying particular attention to the face, armpits, groin, and feet. Dry cleansing cloths, designed for patients, offer an alternative during cold weather or when bathing is undesirable. Benefits: this ensures hygiene even when regular bathing is not feasible. Selecting suitable hair and skincare products. Using mild soaps and shower gels. Opt for pH-balanced soaps, free from harsh fragrances to prevent skin irritation. Moisturizing shower gels containing aloe vera, glycerin, or shea butter will help maintain skin hydration. Benefits: protects the skin, reduces itching and dryness after showering. Gentle hair care. Use mild, sulfate-free shampoos, especially if you have fine hair or a sensitive scalp. Limit washing to once or twice a week to avoid drying out your hair and scalp. Use a light conditioner to improve hair softness and manageability. Benefits: maintains healthy hair and scalp without causing irritation. Moisturizing after showering. Immediately after drying, apply a moisturizer to retain skin hydration. Choose moisturizers containing ceramides, almond oil, or coconut oil to protect the skin's natural barrier. Benefits: prevents dry, itchy, and cracked skin, common issues among older adults. Psychological support for a comfortable bathing experience. Promoting independence in the elderly. Whenever possible, allow seniors to perform simple tasks such as washing their hair, drying themselves, and changing clothes independently. Only assist when absolutely necessary to avoid undermining their sense of self-reliance. Benefits: this fosters a sense of independence and prevents feelings of shame when assistance is required. Creating a relaxing bathing environment. Play soft music or allow the senior to choose a preferred scent, e.g. lavender essential oil for relaxation. Use warm water and gentle massage to reduce stress. Benefits: this transforms bathing from a chore into a pleasant experience. Gentle and patient support for individuals with cognitive impairments. Bathing can be anxiety-inducing or frightening for individuals with Alzheimer's disease or dementia. Maintain a calm and reassuring tone, clearly explaining each step to prevent distress. If the senior resists, consider a more opportune time. Benefits: this reduces stress and promotes a sense of safety and cooperation. 4. Water temperature and skincare products. Ideal water temperature for bathing. A safe and suitable water temperature of 37 to 40 degrees Celsius, ideal for maintaining body warmth without irritating the skin. Water below 35 degrees Celsius may cause vasoconstriction, hypotension, and chills. Water above 42 degrees Celsius can dry the skin, cause dehydration, and increase the risk of dizziness and stroke. Benefits include protecting the skin, preventing thermal shock, and promoting a comfortable bathing experience. Checking water temperature. Use a thermometer, especially for the elderly who may have reduced skin sensation due to conditions like diabetes. If a thermometer is unavailable, test the water with your elbow or the back of your hand. These areas are more sensitive than the palm. Avoid sudden temperature changes during bathing, particularly when transitioning from warm to cold water. Benefits include ensuring safe and suitable water temperature and reducing the risk of burns or thermal shock. Adjusting temperature according to weather conditions. In winter, slightly warmer water, 38 to 40 degrees Celsius, is recommended to avoid feeling cold. In summer, slightly cooler water, 35 to 37 degrees Celsius, can prevent skin dryness. If bathing in warm water during summer, rinsing with slightly cool water afterward helps regulate body temperature. Benefits include improved comfort and better temperature adaptation for the elderly. Selecting suitable skincare products. Bath and shower products. Choose a bath product with a neutral pH, 5.5 to 6.5, to avoid stripping the skin's natural moisture. Prioritize soap-free options without strong fragrances, as older adults' skin is more prone to irritation. Opt for moisturizing washes containing ingredients like glycerin, aloe vera, shea butter, or almond oil for enhanced hydration. Avoid harsh antibacterial soaps or washes containing sulfates, SLS, SLES, as these can dry out the skin. Benefits: gently cleanses the skin without causing dryness or irritation. Hair care. Select a mild shampoo free of sulfates and alcohol to prevent dryness of the hair and scalp. Limit washing to 1 to 2 times per week to avoid stripping natural oils. Use a light conditioner to improve hair softness and manageability, especially for those with thin or easily tangled hair. For excessively dry scalps, consider using coconut or argan oil as a hair treatment. Avoid shampoos with strong fragrances or harsh detergents, as these can irritate the scalp. Benefits: maintains healthy hair, reducing dryness and breakage. Post-shower moisturizing. After showering, apply moisturizer while the skin is still slightly damp to lock in hydration. Choose a moisturizer containing ceramides, almond oil, jojoba oil, or glycerin for deep hydration and skin barrier repair. For extremely dry or flaky skin, consider using body oil instead of a traditional cream. Avoid moisturizers containing drying alcohol, ethanol, or strong fragrances, as these can cause irritation. Benefits: provides long-lasting hydration, reducing itching and dryness, common concerns for older adults. Hand and foot care. Use hand and foot creams to prevent cracking, especially during colder months. Soaking feet in warm water for 5 to 10 minutes before bed can relax muscles and alleviate dryness. Regularly trim toenails to prevent ingrown nails and discomfort. Benefits: reduces cracking, keeping hands and feet soft and healthy. Special considerations for elderly skincare. Avoid prolonged and frequent bathing. Limit bathing to 2 to 3 times per week. On non-bath days, consider using warm towels to cleanse the body. Each bath should last only 5 to 10 minutes to prevent the loss of natural skin moisture. Benefit: this helps maintain skin hydration and minimizes the risk of dehydration. Use warm water instead of hot water for facial cleansing. The facial skin of older adults is thinner and more sensitive. Therefore, use lukewarm water, approximately 32 to 35 degrees, for cleansing. Employ a mild, low-foaming cleanser to avoid stripping the skin of its natural moisture. Benefit: this prevents dryness and irritation. Wear warm clothing after bathing. Dry the body thoroughly after bathing, paying particular attention to the creases in the skin, such as between fingers and toes, to prevent infection. Wear loose-fitting, absorbent clothing to avoid sweating and skin irritation. Benefit: this helps maintain a stable body temperature and reduces the risk of catching a cold. Number 5. Hair and oral hygiene care. Hair care for seniors. As we age, hair often becomes thinner, weaker, more prone to breakage, grayer, and less shiny. Maintaining healthy hair requires attention to washing frequency, shampoo type, and overall hair and scalp care. Proper hair washing. Wash your hair 1 to 2 times per week to avoid stripping natural oils. Use lukewarm water, approximately 35 to 38 degrees Celsius, to avoid drying the scalp. Choose sulfate-free shampoos, SLS, SLES-free, to prevent moisture loss. Opt for shampoos containing biotin, keratin, argan oil, or grapefruit essential oil to stimulate hair growth. If you have dandruff, select a shampoo containing zinc pyrithione or ketoconazole to reduce inflammation and fungal growth. Gently massage your scalp with your fingertips while washing to improve circulation. Benefit: cleanses hair without stripping moisture, promoting stronger, healthier hair. Post-wash hair care. Avoid brushing wet hair, as wet hair is weak and prone to breakage. Gently pat hair dry with a soft towel instead of rubbing. Use conditioner or nourishing hair oils, coconut oil, argan oil, to maintain softness and shine. Benefit: keeps hair shiny and smooth, reducing dryness and breakage. Limiting chemicals and high heat. Avoid frequent coloring, perming, or straightening, as chemicals weaken hair. If coloring is necessary, choose ammonia-free dyes or natural alternatives like soap nuts or indigo. Minimize the use of hot hair dryers. Opt for low heat settings or allow hair to air dry. Benefit: promotes healthy hair and reduces the risk of damage from chemicals and heat. Maintaining a healthy diet for hair. Include protein-rich foods, eggs, chicken, for strong hair. Drink plenty of water to prevent scalp dryness. Consume foods rich in iron, zinc, B vitamins, and biotin, green vegetables, seeds, legumes to stimulate hair growth. Benefit: nourishes hair from within, reducing hair loss. Oral care for seniors, a guide to healthy teeth and gums. Seniors are more prone to dental issues such as tooth loss, cavities, gingivitis, dry mouth, gum recession, and bad breath. Therefore, a proper oral hygiene routine is crucial for maintaining healthy teeth and preventing dental diseases. Proper brushing. Brush your teeth at least twice daily, morning and night, with fluoride toothpaste to protect enamel. Use a soft bristled toothbrush to avoid gum irritation. Brush gently using vertical or circular motions. Avoid harsh horizontal scrubbing, which can cause gum recession. If you experience weakness in your hands, an electric toothbrush can provide better control. Benefits: effectively cleans teeth without damaging enamel or gums. Flossing and mouthwash. Floss daily to remove plaque from between teeth, areas a toothbrush can't reach. Use an alcohol-free mouthwash to alleviate dry mouth and kill bacteria. If you have dental conditions, use a mouthwash containing chlorhexidine or fluoride as directed by your dentist. Benefits: prevents gingivitis, cavities, and bad breath. Addressing dry mouth. Dry mouth, common among seniors due to reduced saliva production, causes discomfort and increases the risk of cavities. To alleviate this, drink plenty of water, avoid coffee and alcohol, which exacerbate dryness. Chew sugar-free gum or suck on sugar-free lozenges to stimulate saliva production. and use artificial saliva gels or sprays if dryness is severe. Benefits: reduces dry mouth discomfort and protects teeth from bacteria and plaque. Denture care, if applicable. Clean dentures daily with a soft brush and water. Avoid regular toothpaste, as it can cause wear. Soak dentures overnight in a specialized cleaning solution to eliminate bacteria. Remove dentures at night to allow gums to rest. If dentures feel loose, consult a dentist for adjustments. Benefits: keeps dentures clean, reducing the risk of infection and bad breath. Regular dental checkups. Schedule dental checkups at least every 6 months for comprehensive oral examinations. Address any dental problems, cavities, gingivitis, tooth loss, promptly to prevent health complications. Benefits: enables early detection of dental issues and maintains healthy teeth. 6. Nail and clothing care. Nail and toenail care in the elderly requires special attention due to age-related changes. Nails often thicken, yellow, become brittle, or grow abnormally due to poor circulation and structural changes. Proper hygiene and trimming are crucial to prevent infection, ingrown nails, and discomfort. Regular trimming and cleaning. Nail trimming frequency. Trim fingernails weekly and toenails every 2 to 3 weeks, depending on growth rate. Proper trimming technique. Cut toenails straight across, avoiding cutting too short to prevent ingrown nails. Fingernails can be trimmed slightly curved to follow the natural nail shape, preventing breakage. Daily hygiene. Use a soft brush or cotton swab to clean under the nails. Soaking hands and feet in warm water for 5 to 10 minutes before trimming softens the nails, making them easier to manage. Benefits: maintains clean nails, preventing infection and painful ingrown nails. Nail and skin moisturizing. Use a moisturizer on nails and hands/feet to prevent dryness and cracking. Apply nail oil, coconut oil, olive oil to strengthen nails and prevent brittleness. Avoid harsh chemicals like acetone in nail polish remover, as they can dry and weaken nails. Benefits: promotes stronger, healthier nails and keeps hands and feet soft. Preventing nail diseases. If nails show signs of fungal infection, yellowing, thickening, brittleness, white spots, seek early treatment with topical or oral medication as prescribed by a doctor. If a nail has a blood clot due to trauma, consult a doctor to prevent infection. Diabetics should exercise extra caution when trimming toenails, as minor wounds can lead to slow-healing ulcers. Benefits: prevents nail diseases and protects overall health. Caring for the elderly's clothing involves selecting and maintaining appropriate garments to ensure comfort, ease of movement, and safety. Proper clothing choices can help prevent falls, skin irritation, and maintain warmth. Choosing appropriate clothing. Prioritize comfortable and soft fabrics such as cotton, silk, linen, or soft jersey to enhance breathability and prevent discomfort. Opt for loose-fitting garments with easy closures. Zippers or press studs are preferable to small buttons. Elasticated waistbands on trousers are recommended over buttons or zippers. Choose calming colors and avoid busy patterns to promote relaxation. Benefit: facilitates ease of dressing and enhances daily comfort. Maintaining cleanliness. Regular laundering is crucial to prevent bacterial growth and odor caused by perspiration. Use mild detergents to avoid skin irritation. Air dry clothing in a well-ventilated area with gentle sunlight to eliminate bacteria and maintain freshness. Benefit: maintains hygiene, protecting the elderly's skin and overall health. Selecting safe and suitable footwear. Choose shoes with non-slip soles to minimize the risk of falls. Avoid excessively high heels or overly loose footwear, which can compromise balance. Use soft, non-restrictive socks to prevent impaired blood circulation. Benefit: promotes safe mobility and reduces the risk of falls. Maintaining body warmth in cold weather. Layer clothing with several thin garments instead of one thick layer to allow for better temperature regulation. Utilize scarves, socks, and gloves in cold weather to maintain warmth. Avoid wearing damp or undried clothing to prevent chills. Benefit: protects health, preventing colds and respiratory illnesses. 7. Addressing the reluctance of elderly individuals to bathe. Elderly individuals may refuse to bathe for a variety of reasons. Understanding these reasons is crucial for developing effective strategies. Cold sensitivity and fear of illness. Older adults are more susceptible to cold temperatures due to reduced blood circulation and decreased subcutaneous fat. Bathing can feel excessively cold, especially in inadequately heated bathrooms. Many fear that bathing will lead to illness. Solution: ensure a warm bathroom environment. Use comfortably warm water, approximately 37 to 40 degrees Celsius, and have towels readily available post-bath. Mobility challenges and fear of falling. Reduced balance and slippery bathroom surfaces increase the risk of falls. The fear of losing control or falling during bathing, particularly after previous falls, can be significant. Solution: install grab bars, non-slip mats, and a shower chair to minimize the risk of falls. Loss of independence and embarrassment. Some older adults feel embarrassed or uncomfortable requiring assistance with bathing. They may refuse help to maintain privacy and independence. For those accustomed to self-sufficiency, needing assistance can be detrimental to self-esteem. Solution: maintain a gentle and respectful approach, allowing them to perform tasks independently whenever possible. If assistance is necessary, consider same-sex caregivers to enhance comfort. Cognitive impairment. Dementia, Alzheimer's. Individuals with dementia or Alzheimer's may not understand the need for bathing. They may experience fear, confusion, or actively resist bathing. They may also forget their last bath. Solution: use gentle, positive language, such as, "Let's relax with some warm water," instead of directives. If resistance persists, try again later when they are calmer. Gently persuading elderly individuals to bathe. Forcing an elderly person to bathe can cause stress, fear, and resistance. A gentler, patient approach is far more effective. Creating a comfortable and warm environment. Ensure the bathroom is warm and free from drafts. Prepare soft towels and warm, clean clothing. Address any concerns about slipping with non-slip mats, grab bars, or a shower chair. Goal: foster a sense of safety and comfort to alleviate anxiety. Making bathing a pleasant experience. Use a mildly scented bath wash to promote relaxation. Playing soft music can also reduce stress. Use a warm towel to gently cleanse the skin before beginning the bath to avoid a sudden temperature change. Goal: associate bathing with relaxation rather than apprehension. Adjusting communication to reduce resistance. Instead of saying, "You need to bathe now," try, "Would you like to enjoy a relaxing foot soak?" If they refuse, don't pressure them. Allow them to decide when they're ready and try again later. Experiment with morning versus evening bathing. Goal: minimize pressure and encourage cooperation. Adjusting bathing frequency. If daily bathing is undesirable, reduce it to 2 or 3 times a week, using wet wipes for cleansing on other days. Focus on areas prone to odor, such as underarms, groin, feet, and face. Goal: maintain personal hygiene even with less frequent bathing. Seeking assistance. An elderly person may be more receptive to assistance from a different family member or a professional caregiver. If one person's help is refused, try another. Goal: identify a trusted individual who can provide comfortable assistance. Now you know, elderly individuals don't necessarily need daily showers, but maintaining personal hygiene is crucial. The key is showering correctly, at the right time, and in a way that suits their physical capabilities. What are your thoughts? Are you caring for an elderly loved one? Have you noticed them resisting showers or experiencing difficulties bathing? Please share your experiences in the comments below. We'd love to hear your stories. And don't forget to like this video if you found it helpful, subscribe to stay updated on other health tips, and enable notifications for the latest videos. See you in the next video.